There's a lot going on, especially with AI. Everyone thinks they're a doctor. How many people do you get that come in and think they know how to inject?
I mean, even patients think sometimes give them a bottle of Botox and inject themselves.
Laser hair removal plans start at $19 a month. Like, it's pretty cost effective. If you think about how much you spend on shaving and then how much you spend on, an unlimited laser hair removal package, it makes financial sense, even if you're on a budget. I think we could both agree that the RHA collection, Versa collection, Juvederm collection, the Wrestling collection, they're all great products. But what some clients seem to forget, and not all, it's not just the product that creates the result. It's more so the practitioner that's doing it. How do you feel about all these overseas procedures going on?
As some things are cost prohibitive here, and it's certainly understandable that why a patient doesn't want to spend $30,000, $40,000 on 5,000 grafts of hair transplant. But the problem with surgical or cosmetic surgical tourism is that.
Welcome back, guys.
And today we're going to talk about maybe some controversial trends or procedures or new developments in the medical spa cosmetic industry.
Wellness, yeah. So there's a lot going on, and it's confusing, especially with AI, and everyone thinks they're a doctor, right?
Mm-hmm.
How many people do you get that come in and think they know how to inject?
Yeah. I mean, even patients think sometimes give them a bottle of Botox and inject themselves. But
yeah.
I mean, I've seen a couple, I think the first type of cosmetic application of robotic surgery was for like hair transplants. From what I could see, there's the robot that does hair transplants.
Mm-hmm.
And it pulls out the follicles and makes a slight incision and transplants it. I've never heard that much success with that particular robot versus like a really skilled human technician, but now I've seen ones that do, and this is a little outside the realm of med spas, but eyelash extensions. And now there's like a new laser that
Fractionated, yeah.
And it's there's no technician required. You just put the body part under the laser and it does the rest, or how?
I would think that would be controversial, right? Especially with the licensure, right? Because I guess AI, in a sense, could detect the skin type, but is it asking the right questions about contraindications? I doubt it. How is it speaking to the patient? So there would need to be some sort of human interaction there.
Yeah, there's going to be qualifiers, but
right?
I mean, I think you'd also need a technician present either way. So,
what do you think about it?
I think right now it's probably just a cute fad. I don't think there's really any, financial application to it.
What about, I see all these companies, right? And there's a bunch of TikTok trends where clients will buy these at-home laser hair removal devices. Mm-hmm. The thing blows up, leaves them with burns, whole 9 yards, but it's marketed as permanent hair removal. You could pay like a couple $100 for it, and you don't have to shave anymore. What's your take on these devices? And
well, they're IPL,
yeah,
right?
Which
laser.
just doesn't work for hair removal. Let's just put that out there.
Maintenance, and you have to do so many sessions, and they're not very comfortable sessions, even if you're doing it at home. And it's largely ineffective. I mean,
you're just wasting your money.
You got to spend a lot of time doing it, and like it's seriously not a very effective form of hair removal, permanent hair removal. Not even close. I mean, it might work if you do it every day or every few weeks, and you do it. You spend, an hour torturing yourself at home with this thing that hardly works, and maybe after 3 or 4 months, you might start seeing some reduction in hair, but it's nothing like getting a really popular treatment with a certified
electrologist. Yeah. We and what's funny is it's just good marketing, right? Because we've got plans. You've got plans. Laser hair removal plans start at $19 a month. Like, it's pretty cost effective for someone who, if you think about how much you spend on shaving and then how much you spend on an unlimited laser hair removal package, it makes financial sense, even if you're on a budget. But from a result standpoint, you couldn't even have them on the same scale. And from a quality and safety standpoint, I don't even think they're, adequately comparable.
And there's those skin tightening devices, those at-home skin tightening devices.
Like with the EMS. Yes.
Electromagnetic.
Yeah, I see all that stuff.
There's a lot of them over the counter that sell at salons or even in department stores, etc. But I don't. The effects, if they do work, it's fairly temporary, I think, and doesn't compare even to closely to skin tightening procedures done with like a Morpheus 8 or soft wave or therapy or some electromagnetic frequency stuff. But I mean, that stuff is not all that effective to begin with. And I mean, of them all, I think soft wave is the best, but you still have to maintain it. You still have to do a little maintenance every 1 or 2 years.
Speaking of maintenance, how do you feel about was it Bellafill that came out and it was a permanent filler and all of these doctors
5 years, I think it was supposed to last.
Yeah. And all these doctors started to use it and there were some significant adverse reactions behind it. What's your take on it? Nothing out there is permanent, right? Even if you go get a facelift, is it permanent?
No. I mean, and that's the thing with people, like they'll get a procedure that is supposed to produce results for a certain amount of time, but also in that time, maybe it's 3 to 5 years, they've also aged. And depending on what age they start at, they could age much more significantly than, say, a person that's going from 20 to 25 than a patient that's going from 45 to 50. And, they could say, oh, well, I got this fillers done a couple of years ago. They used to last on me, look great for 3 years, but now I get fillers and it looks only good for about a year. And it's, I mean, they discount the natural effects of aging. And when you take that into account, I mean, it's a little bit more convoluted than just measuring, the results of a certain treatment. Now, Bellafill, for example, I always stayed away from it because if you do have a result that you're unhappy with or the patient's unhappy with, they can't reverse it. They're stuck with it for a long time. Also, granulomas, scar tissue, unwanted side effects are very difficult to reverse and treat. So I'm not a big fan of those kinds of treatments.
We get a lot of clients that come in and they'll put, 4, 5, 6, 7, up to 10 syringes of filler in their lips over the course of, a couple different years. And they develop these shelves on their lips and they've got all these nodules in their mouth and they're scared to dissolve and they want to keep stacking on top of it. How would you address that? Are you injecting filler? Because you think about it, right? All these clients keep going to the same injector, or maybe it's different injectors, and they keep putting filler on top of it. Are you going to continue to put filler on top of it, or are you going to require a Hylenex treatment?
Obviously a psychological component to that. There's certain patients, even if you suggest dissolving it, they'll run out of your office.
Dissolving seems scary, right? Everyone thinks dissolving is so scary.
Well, you know what the problem with dissolving is? Most people don't know how to do it properly. There is an art to dissolving, just like there's an art to injecting fillers. And a lot of places will just inject large boluses of hyaluronidase into the affected areas, and they're not careful about it. And you should be very conservative with the amount of hyaluronidase you inject, especially depending on what you're trying to correct. Usually, it's fairly subtle, and only requires like 50 to 100 IUs of hyaluronidase. But there are downsides. I mean, first of all, you have to make sure the patient's not allergic to it, and you have to do a little bit of an allergy skin test prior to doing that. And then second of all, you could lose a little bit of collagen and elastin if you deflate that area too much. It can have unwanted side effects where it's actually worse than before the filler was injected. So you have to be very conservative how you do it and inject the proper depth at the proper amount in each injection and space the injections properly.
You know, I think there's a lot of providers out there that aren't doing the allergy test prior. They're just, you know, going straight in for the dissolving, and there is a huge risk of complication there. And that just goes to show you about the...
Yeah, it's not common, but when it happens, you're going to have a problem.
Yep. It's just like getting an online certificate that you're a certified injector after, you know, going to MP or PA school.
So, yeah, I mean, when you have patients come in with obscenely large, overinflated, overinjected lips, I mean, it's hard to handle that because, like I said, there's a psychiatric component, there's a psychological basis for this. They've obviously gone to someone that doesn't care about outcome or has no understanding or concept of what looks good, and they're entertaining a issue that is detrimental to the person's overall health and physical appearance. So, I mean, yes, you have to dissolve appropriately, and if the patient's lips have been like stretched beyond the limits of the skin, I mean, you're going to have some loss of elasticity when you do dissolve. So, I mean, it's a problem, but I mean, it should never get to that point. There should not be injectors out there that are just exploiting these people for financial gain.
You know what? What's kind of funny is all of these aesthetic companies, you know, they've got great marketing. It's very important. Wrestling Kiss did very well with their launch. I think we could both agree that, you know, the RHA collection, Versa collection, Juvederm collection, the Wrestling collection, they're all great products. But what some clients seem to forget, and not all, but it's not just the product that creates the result. It's more so the practitioner that's doing it.
Yeah, obviously. The correct product used for the correct procedure and where you're injecting it is obviously very important. You make the selection of the product based on the site of injection, what you hope to achieve by the injection, and the duration of the result that the patient wants. And, you know, there's some perfectly good fillers out there that don't last very long, that people don't want to commit a lot more finances to something that they're not sure how it will look. And then once they get more comfortable with fillers, they're more prone to use the longer lasting, better quality fillers like Voluma or Volux, stuff like that.
How do you feel about all these overseas procedures going on? My stepdad, actually, he went and got a hair transplant in Turkey. Seemed to go very well. But I hear a lot of clients that, you know, are international. Botox is like $1 a unit, $2 a unit, $3 a unit. Mm-hmm. Filler over there is nothing. I mean, you can forget about the price of it over there.
And it's like anything. I think there's certainly people over there doing a good job with it. There's certain regions that are known for doing very good work, especially with like hair transplant procedures in Turkey. There's a couple other countries where it's fairly common and they do a pretty good job. I mean, yeah, some things are cost prohibitive here, and it's certainly understandable that why, you know, a patient doesn't want to spend $30,000, $40,000 on like 5,000 grafts of hair transplant. But the problem with surgical or cosmetic surgical tourism is that if you do have a complication, you don't have anyone to manage that. Yeah. And a lot of people, a lot of the local physicians are not want to get involved in someone else's work. So, you know, you run into those problems.
You know, minimum wage is now $14 an hour. And people are like, why is getting my gas so expensive when I go through the drive-thru? You know, I can't leave it without spending $20. And, you know, I hear it with aesthetic procedures, right? And you've got all this venture capital in the industry trying to, you know, beat everyone with price. But it still comes down to service, right? I mean, 9 out of 10 times you go to 10 different McDonald's, it's going to be just about the same, right? But you go to 10 different clinics and you're going to have a different result at every single one of them.
Yeah.
or at least the majority of them.
Yeah. I mean, certainly you can't treat it as a product. It's a product and a service. Certainly there's a consumable portion of that service which is a fixed cost. But the other part that's equally important is the service part. I mean, you could buy an expensive part for your automobile, but if it's not installed correctly, it's useless. So, I mean, same kind of a concept when it comes to injecting a dermal filler by a licensed provider. You need someone that's selecting the correct filler for the correct area and also very experienced in how to inject it properly.
We have a bunch of practices near all of the different locations, and they've all got unregulated China machines, you know, that have the same name or very similar. You know, it's like a different logo on there. And they're charging a fraction of the price, and people are paying for it.
Yeah, and I mean, honestly, they don't have the FDA approval or the patents in this country, but the people that are at fault, part of the fault is the actual manufacturers aren't really going after those.
You know, they should be.
I don't know why they're not, but there's a lot of places that are clearly doing it, infringing on their patents, infringing on their, actually representing it as their product, and you know, instead of paying $150,000, $200,000 for a piece of equipment, they pay $5,000, and they're getting away with it. And that product is certainly not producing the same result as the product that's licensed for use here in the States. I mean, there's a whole bunch of examples we could go into.
Even if you take the result out of the picture, right? Just maybe you get a similar result 1 out of 10 times.
One thing, well, the thing is, the patients aren't necessarily educated on this, and they don't know the difference. But one thing to look for, if the place you go to has their logo on the machine, that's a red flag.
Yeah, it is a big red flag. But you know, back to my last statement, if you take the results out of the picture, right? What about from a safety standpoint?
I mean, yeah, obviously it's not been tested as thoroughly for safety and efficacy. I mean, you might get lucky and they have a decent machine that doesn't produce really adverse outcomes. But I mean, just hair removal lasers. I mean, those. I mean, you're much more likely to get burned.
So we had a patient that came in off of a Groupon, completely fine, new client promotion. This is like a year ago, and she, you know, was going on to maintenance after her package of 6 or 8, and she didn't want to pay it. Completely okay, and she went to another clinic. And the clinic called us to obtain the settings. Big clinic, well-recognized clinic. They called us to obtain the settings because they didn't know what to put her at. She was on a YAG setting, right? Darker skin type. And they didn't know what to put her at.
You're kidding me.
Swear. And they call. They're like,
was it using the exact same machine?
Same exact machine. And then the patient called and she was like, hey, listen, I need to obtain my records. I'm going someplace else. And they just need to see the settings to make sure that I'm eligible for treatment. I was like, tell her she can sign a medical records release consent and we'll release everything.
Wow.
But it blew my mind. I was like, that's
not a red flag for that patient.
This is a practice. It's got, 100 locations nationwide, and they're calling to do stuff like that.
Yeah, that's scary. That's pretty problematic. It's like taking your car in to get it fixed, and one mechanic calls the last mechanic you had it and asks them how to do it. I mean, it's obviously like in any other application of this kind of mentality, this kind of approach to doing business, it would be people would be like, "This is craziness." But when it comes to aesthetics, you get away with murder.
But why? So for the car, for example, right? It's got no heartbeat.
Yeah.
It's a materialistic object. It could be replaced, right? But your skin, How are you replacing it? I mean, I guess theoretically, sure, but it's your safety. You're jeopardizing safety for a currency, and there's a problem with that. There's a big problem with that.
Well, why did this person leave you in the first place?
It was overpriced. It was overpriced.
Really?
It's because like any company out there, I mean, the biggest of the biggest, the overall goal is to acquire a client to show them what the experience is, right? So
you bring them in.
Majority have it's
price.
a loss leader, right? Just to obtain them, to show them what it's supposed to be like. And 9 out of 10 clients, maybe it's 8 out of 10 clients will stay and to end up leaving. But when you go to the regular price, right? Because employees have to be paid, the lights have to be kept on. You've got to continue to provide jobs and safe services, and regulations change. And they might not like it. They might want to stay at that promotional price, and it's not profitable, and there has to be some sort of profit. So she left, and there's nothing wrong with that, right? I mean, sure, maybe you can go to another clinic and have a great experience. There's a bunch of good practitioners and practices out there, but this specific clinic, they didn't know how to treat her.
Yeah. Oh, it's interesting. I mean, and you'll have patients that come in and they'll tell you they want to. Well, they'll question a lot of things. You have the exact other extreme of the spectrum, where they're extremely skeptical, and they basically want to give you a job interview before you inject them, and they want to see the product before you open it up. They want you to open the product up in front of them.
The lot numbers.
Yeah, they want to see all of this stuff. They want it prepared in front of them. I mean, I could understand if you've had a few bad experiences, but if you're that untrustworthy with the provider you're going to,
why go?
You probably shouldn't be going there.
Why go?
And my attitude with patients like that is I don't want to deal with it because, in some level, a certain amount of reassurance is understood. But when it becomes almost insulting to the point where you're having to undergo a job interview before performing a procedure, I mean, they have reviews, they have research they can do on their own. But, I mean, if they're that scared and that suspicious, I don't think that's the kind of patient you want in your practice.
Some of these, some patients are going to be like that, right? But do you think it's because of a bad experience, or do you think it's because they're just maybe not educated on the services?
I don't know.
My big thing is why not just come in for a consultation, and talk to the provider prior to purchasing anything?
Yeah.
Right? Well, so like before you start with a company, what do? You go through an interview, right? And you're applying for a position, but you're also getting a feel for that company to see, maybe it's a good fit, maybe it's not a good fit on both ends. It's on both ends, right? But you have a lot of patients now that want to just jump right into a procedure without knowing, risks, complications. Maybe there's contraindications with their previous medical history, or maybe it's just not a good fit with that provider in practice. But once you do find the right fit, you should probably stay with that practice and provider.
Yeah.
And for the practices that have all of this turnover, new hire, there's probably also something wrong there.
Oh, definitely. Yeah. I mean, either the provider had a bad experience, or the patient had a really bad experience and they had to get rid of the provider, or just the culture of the whole facility is problematic. But if they're having a lot of turnover, or anyone good that's been there for a while, then they suddenly leave, you gotta question what's going on there, because I get that from a lot of patients. They've had a provider for a number of years, and suddenly they're gone, and they have to go and find someone new.
There's obviously an aspect where you have to be compensated correctly, and the work output has to match that, right? It's got to be a mutually beneficial relationship. But I try hard, to keep all of my providers, everyone, not just providers, but also admin, because it's like a family, And a lot of these practices, you get so big, and it goes more corporate to where it's no longer like a family and clients no longer feel welcomed. And we're in an elective industry. And I don't think that should ever occur.
Yeah, I mean, for sure, it's like when you have a business that isn't a large corporation with hundreds of locations, and they're operating more on a very personalized approach to each patient, or the importance of the patient experience is just as important as the outcome. That's a big deal, and when you have good staff and exceptional staff, I mean that's indispensable. I mean you can't let that happen. Let them go. You have to do whatever you can to make them stay.
Yeah, it's very important. What just came to thought? Remember, so I went for a visit for my knee with all the issues that are going on, and great place, great doctors, super successful. Everyone
orthopedic surgeon.
Yeah, everyone loves them. And I sent you a picture of the peptides that they're now prescribing, as well as administering stem cells post-procedure, and the presentation behind it, right? Because everyone thinks they could, somewhat engage in something different. And what did you think of that?
I mean, it's funny. And maybe they're providing a good service, but when it looks like something prepared on a Word document that was done in 5 minutes by, I don't know, the front desk girl. I think it unfortunately it discounts the authenticity and maybe the value of the procedure. I mean, and alternatively, could have really flashy, beautifully done advertisements that are using garbage products. So yeah, you don't want somebody doing it as a side gig or just like a little extra way to make some money.
Did you see the payment method options though? Like you can't pay with it. I mean, I guess you can't pay with your credit card, I think, but the preferred options are like Zelle, cash.
Yeah, that's suspicious. That means they're getting a lot of chargebacks. But
it's just a little abnormal, very educated practice, doctors, everything of that nature. But I think you just have to trust who you're going to. I think that's where it lies. If you don't trust who you're going to, then how could you, regardless of the presentation, good or bad, how can you continue to go through with a procedure operation, invasive or not invasive? There's a lot of surgeons now that portray themselves as plastic surgeons, but they have no board certification in plastic surgery. They've got like a cosmetic surgery. And there's a big thing going on where it's like, oh, we can do non-local anesthesia where you don't have to go to sleep, right? It's like a wake. But I've recently heard that it's because they can't put you under local anesthesia, and they market it as if
general anesthesia.
Yeah, general anesthesia. Yes, and they market it as you no longer have to go to sleep for a breast augmentation. And how do you feel about these doctors? You have a residency in something else, and you're hopping into a different specialty of medicine.
I've seen this before. I mean, I've seen obstetrics gynecologists, and I mean, you typically don't see it as much in larger urban settings, but when you're in more sometimes rural outfits where there's smaller cities, you could have I knew of one case where this gynecologist obstetrician was doing breast implants, and they had no training in it. I mean, yeah, sure, they can do hysterectomies and stuff like that.
But even if you did have training in it, real quick, even if you did have training in it, right? What's the point of going through your residency? Like you went through a residency, and
I mean, that's not part of the residency.
Yeah. So why should you be allowed to operate in that scope?
it's these laws have been grandfathered in from many years ago. So like I told you, a physician has the right to pretty much practice any field of medicine they want to. Now, the liability exposure could be huge as soon as they want to do general surgery and they've never been trained to do surgery. I mean, from a legal perspective, they can do it. But yeah, it's unfortunately becoming a problem because now, like, first it starts out as a little bit of local anesthesia and you're doing some minor liposuction, and then, you know, because there's a lot of in-office liposuction procedures you can do, and you do fat grafting to certain parts of the face. But I mean, and then it just expands from there. Say they have a plastic surgeon that they've worked with for a while, and that's not too hard to do. I'm going to start doing that too. And so, and the one way of bypassing the general anesthesia requirement is to do local anesthesia, you know, in the area that you're performing the surgery, and it's sufficient in a sufficient way to make it tolerable for the patient. But I think that's the only one I know of that's really okay for that is like blepharoplasties. A lot of blepharoplasties are done in office under local, but
Yeah, but is it a plastic surgeon doing it when you see that?
well, a bleph could be done by ocular plastics, with like an ophthalmologist with you know, some training in blepharoplasties, or ENT with facial plastics, or a plastic surgeon. But the one thing you don't want to go is, and we're talking about plastic surgeons now, go to see a plastic surgeon that does a bunch of different plastic surgeries. I mean, you want them somewhat specialized
In something.
Yeah.
You know, what it seems like is just because you might be legally allowed to do it, it doesn't mean you should do it.
Oh, no, absolutely not. And that's why most doctors would never do that, because they have one adverse outcome and they're gonna be sued.
Or even just, you know,
so if they're not, you know, board certified or very proficient training in that area.
You work so hard for a license, it took you, you know, well over a decade to obtain, and then you put it in jeopardy by doing something like that.
It's unusual, but I don't think you'll see too much of that. But I mean, there's a lot of stuff that happens. There's a lot of surgeries that happen in kind of underground, back alley type places where there's not even a real surgeon doing them. I mean, there's some crazy stuff that happens even in this country.
You think it's related to affordability?
Oh, for sure. I mean, affordability and
Number one factor.
Just like the you go to a place for dermal fillers and Botox is you come do it out of someone's apartment that just flew over from Lithuania, and they got a group of people that they refer. You know, it's word of mouth, and they have all these patients coming in and out of their apartment getting all these procedures. It's same kind of thing. And obviously at a fraction of the price.
You know, I guess you're going to have bad or uncompliant people in every industry, right? I mean, you look at the scandal that just happened with the NBA and everything like that. You've got reputable people crossing lines. You know, there's speculations on everything, and there's always going to be stuff like that. But there are ways to prevent it. You know, if you're a provider wanting to get into the industry, don't just go online and do an online certification after your degree, right? There's an art to it.
Yeah. I mean, you gotta be exposed to hundreds and hundreds of cases and follow-up care, and that's the only way to really learn, just like in anything, you know, whether it's surgery or delivering babies or anything. It's like you don't learn from delivering one baby.
There's a statistic out there. It's like 10,000 hours just to actually perfect a craft.
Yeah.
Right. And if the average person sleeps 8 hours a day, right? A lot of people don't.
It's not the ones that go smoothly. It's the ones that don't go smoothly.
Yep.
That's where you really learn, and that's what you need to be prepared to handle.
You know, we've had complications, as you know, and you know the patients that have had those complications are patients that have never left. Every complication we've ever had, you know, the providers have just handled so well, and I think because of that, the trust has with the patient and that provider grew so tremendously that those clients just never left. I've seen some horror stories out there where, patients have an adverse reaction and the provider has no idea what to do.
Or they blow it off.
Yeah, it's a big thing too. You don't. You
can see
act
that
like
a lot
it's
with
nothing.
plastic surgery, which is unfortunate. I mean, I've seen some really horrible things with very reputable plastic surgeons that just think they're, untouchable, and if they have an adverse event connected to a surgery they just performed, they kind of kick it to the curb. They don't even bother with it. I'm blown away by it. But it's very hard in a lot of cases when you're talking about malpractice. The amount of gross negligence that's required to have an attorney take it on contingency is quite substantial. I mean, a lot of
because attorneys, right? So if you were to hire an attorney, if I hire an attorney, it's expensive,
Mm-hmm.
In my eyes, having an attorney is a luxury. It is, right? It's for people who can have the money to spend, to have an educated attorney to pursue or represent themselves on anything that occurred or maybe occurring.
Mm-hmm.
But when it comes to personal injury, no dollar amounts allocated. Nothing. Absolutely. I mean, like if there's malpractice or negligence or an accident, you don't need to spend $1, not a single dollar. And if these providers just perform the procedures in the proper ways, and maybe it was an accident, maybe something occurred, and then they address the situation appropriately, that would be, it would eliminate that industry of malpractice within medicine.
Yeah, I mean, like there are countries where the bar is much higher to come after a physician, like Canada. I mean, there's positive and negatives to that because I'm not.
What do you mean?
I'm Canadian, and I'm very familiar with the Canadian healthcare system and the amount of negligence that occurs there that they get away with because they can't really be. There's no accountability for a lot of the malpractice there and a lot of the negligence that goes on when their approach to a lot of patients is the bare minimum, the kind of bare minimum you see in a lot of socialized medical care, and that you can applaud it in the sense that they make it more difficult to come after physicians, and a lot of physicians have to undergo like many futile lawsuits for no reason, no fault of their own. But at the same time, there's, the protections provided by that we have in the U.S., where if someone does really perform with gross negligence, there is some kind of recourse for the patient. What I'm saying, though, is in a kind of the gray area of medicine where gross negligence isn't well defined, you need to meet a certain threshold, which can be difficult to meet. Cosmetic surgery, especially with all the consents they sign, to get a lawyer involved on contingency, because the lawyer's not going to want to spend a whole bunch of time and get nothing out of it. He wants a slam dunk case, So I've seen some cases with sepsis, with severe scarring, severe long-term effects where they couldn't get a lawyer to take the case.
But what blows my mind is like you'd think these doctors would just be human.
Yeah.
I mean, like just be a human being. Right?
Yeah,
like
you'd be
mistakes can happen, like, and that's where you're made or you break. Some of the most successful people in the world have made catastrophic mistakes and have learned so much from it that it took their career so much further, right? But why do you think they just would, just address it, to go head on to that scenario and figure it out?
I mean, there are so many great doctors that do. I think we're talking about the exception to the rule, but unfortunately, a lot of those kind of people exist in this society where they're only motivated by money and nothing else.
Speaking of money, dentists doing Botox.
Yeah, I mean, just like anything. It's a side gig. It's
you're in my treatment,
it's not just
Jay.
Botox. Basically, they're
fillers
do
and
every cosmetic procedure that you would do at a medical spa as part of
I
their
personally,
dental
the
operation.
medical spa isn't the proper term for the establishment. I think we could both agree there,
It's
right?
antiquated, yeah.
I mean,
we need to come up with a new
d-
term.
yeah, that separates a medical spa for what should be done, right?
Yeah.
Because I mean, you can go into a 500 square foot location and someone could have a used hydrofacial off of Facebook Marketplace
Or eBay and they
and
could have,
fake cool
some Botox
sculpting.
from Korea or
Yeah.
China, and they could have.
And it's like a 5,000, not even, maybe not even, like a couple $1,000s for startup costs. And now they're an entrepreneur and a business owner and a provider, and they've got a med spa.
Mm-hmm. I mean, there's so many more services, medical spas or wellness centers, and there's a lot of overlap with that. I mean, all the IV places that have turned into basically cosmetic facilities.
I see a lot of them
wellness
shutting down,
centers.
though.
Not enough.
Yeah, but there's a. I mean,
You see a lot shutting down, but you see a lot starting up.
of
too.
course, because they're trying, right? I mean, there's some good people out there that are going to make an impact, as much as there are bad people that are also going to make an impact. But my role is
it needs a new identifier. It needs a new description. Medical spa doesn't cover. That's a term from 20 years ago, and it doesn't apply to the current state of the industry.
maybe episode 5 and we'll have it. You never know. But all of the reps for Galderma, and not necessarily Galderma, more of our device reps like Softwave and our BTL reps and Candela and Cartessa. I'm on their list for if they have a clinic go bankrupt, they could, if they're on an agreement with the company for like 12 months of installments or something, like sell me the equipment, I'll take it over. Right?
Interesting.
And they text me all day about it. Hey, we just had a practice go out of business. I don't know if they're going to try and do a whole liquidation, but if not, like, would you be interested in buying some of their equipment? And it's for providers out there who are looking to obtain equipment. It's a great way to get really good equipment at a discounted price. And for all these clinics that are popping up left and right, that are trying to do it the right way, it's still complex.
Yeah.
It's not like you could just, I mean, theoretically you can. Like, you could just try, but I mean, the amount of statutes that I've read in terms of compliance, it's never ending. And I'll hire a compliance company and I feel like they have no idea what they're talking about,
Yeah.
Because they're based in New York, or even if they're based in Florida and they're based over here, it varies from state to state so much. And, realistically, within the statute, for our realm, if you perform predominantly aesthetic services, 51% or above is how I think they would how they would classify it. The supervising physician needs to be plastic surgeon or derm. We've talked about this, very old statute. But when you dive deeper into it, their schedule needs to be posted in the license board. And you could probably walk into 100 of these clinics, and do you think the supervising physician schedule's in the license board? They need to be within a connecting county where they share borders, right? Broward, Palm Beach, Martin County. Mm-hmm. And if this is for one that's majority aesthetic, that supervising physician can only supervise one other med spa outside their primary practice. And I know there's MD negligence there as well, right? Because I see these supervising physicians that'll supervise practices that don't just do wellness or don't just do laser and do 100% aesthetic services. And you could look it up on MQA. Mm-hmm. And they've got a Rolodex of clinics that they're supervising. How?
I mean, I think it should be maybe mandatory as far as your CME licensure with regards to being a medical director. I mean, because what are you going to go hire a healthcare attorney every time you want to
deal with a
A lot
complaint
of
or like
they're not easy to find. I mean, I know you've drilled down and you found all these statutes and all these idiosyncrasies regarding it, but it's not clear. I mean, to most physicians, it's not like they're educated in, all the laws regarding becoming a medical director.
which is okay, but if you are willingly in the know of it, that's when it's wrong.
Yeah.
Right? You might not know about it. There's a lot of statutes out there and all these regulations, but if you do know about it, then it's wrong, right? And regardless of
But how wrong is it?
Yeah, but
if
here-
you have a statute that's never enforced,
I know.
and nobody complies with it, like you said, the schedule, the
Yes,
doctor
but-
schedule pasted in the lobby. I mean, I don't think a single occurrence of that I've ever seen.
But here's the thing, though. Regardless if you're compliant or not, and like you think you're compliant, maybe you're not. What's important is that you have someone that you can go to, and that's where a lot of these clinics, and some of them do, right? I mean, there's great places out there. That's where a lot of these clinics screw up, right? Because they think that this is just sufficing or adhering to a compliance standard. But if they have an adverse reaction, they don't know how to handle it and they don't know who to call.
And they can't call their medical director.
He doesn't even have their phone number.
Yeah.
I see these physicians like posting on these practice websites and stuff like that. And I'm just like, maybe he does have involvement, right? Maybe there's some involvement. But if you're a patient going to a practice, I mean, you should probably want to see some curriculum about the physician or someone that's on their executive medical team.
Yeah.
Right? Because at the end of the day, there's levels to everything. And within the medical scope, right, you've got RNs, you've got PAs, MPs, and then you've got MDs and DOs.
Yeah. And again, most people walking into one of these medical spas don't even know that they're required to have a medical director or that a physician should be involved at some point.
What about from wellness? You have a lot of clinics that are just like prescribing testosterone and stuff, and they've got no medical director anywhere.
Well, they need to,
But they don't.
But yeah, I mean,
why is it because the state's like, we've talked about this, but like, you think the PAs and MPs are just like fully
no,
they're okay with
no,
it?
They have a one size fits all approach, and they typically do the same thing for every patient, and that works for a long time until it doesn't work, until they have one serious adverse outcome or something that flags them as performing a lot of services that they shouldn't be or don't have the requisite knowledge to perform, or just pure negligence. I mean, like I said, most of these places the physician is not involved in physician-patient care. It's a salesperson. It should be called salesperson-patient care because that's what it's become.
What seems to be big right now is tattoo removal. Like, I mean, it's always been decently big, but I'm seeing a lot of significant growth in it. And we were talking about it with like the Pico and the Nano, both modalities, to combat the full removal of a tattoo. And I'm seeing a lot of tattoo places pop up, and we bring in that company Reversitat into Jupiter, and they do good work. They know what they're doing. But I also see like people burning holes through their skin. Like there's these practitioners that they don't know how to operate a laser, and they're going in for tattoo removal. And like these people can end up with like sepsis, like serious like ink poisoning, and
you got to be careful, yeah, because I mean you have to get fairly deep within the dermis, and the way to mitigate burning someone is by the duration of the pulse, where you have picosecond or nanosecond, and that pulse is to get in there deep enough to hit the pigment, break it up into smaller pieces so that your body can absorb it. And there's certain types of lasers use the initial set of treatments for tattoo, and then further down, as you progress to removing the tattoo, you have to move to a shorter duration laser. So, I mean, yeah, it's not a simple process. You can have a lot of scarring, you can have a lot of pain, you can have infection if it's not managed properly. So just like any burn. So yeah, it's. I think it's a field of cosmetic medicine's getting a little trickier because a lot of the places doing it have had some bad experiences, and they just felt like it's not worth their while.
You know, we probably get like 100 applications a week on our career portal, and it's a lot of new grads as well. And I think it's probably one of the most demanded positions right now, or wanted positions, is in the aesthetic realm. Anything within the aesthetic realm. You're an RN, you want to come out of the hospital, right? If you're an esthetician, we also require your electrology license, right? Because if you just want to be an esthetician, there could be some good money in there, but not like great money, right? You need to be very educated with the skin to also operate lasers. So we require an electrology license if you're an esthetician. But from RNs wanting to leave the hospital, from nurse practitioners and PAs recently graduating, no longer wanting to go into any other field besides aesthetic medicine.
Yeah, that's right. I mean, because there's a lot of financial upside, but again, it's not for everyone. I mean, how many people's places have you walked into where the furniture is atrocious?
But dive into the financial upside.
The wall is atrocious. So
I want you to dive into it. Like, really dive into the financial upside on it, on like the complexity of it. Like, how hard it is.
It's not easy. I mean, but if you can become very good and proficient and make a name for yourself and get a following and work for a very reputable facility, I mean, you could be making very, very good money.
But I think people, everyone, like, it's not a shortcut. It's not a shortcut.
A doctor's not a shortcut to making money. It's like anything else. There's a lot of time and training and perseverance that goes into it. But when you're dealing with cosmetic, and this applies to plastic surgeons too, I mean, just because you have the training doesn't mean you're good at it. I mean, you have to have the innate talent, the innate eye for proportions, for symmetry, or even the technical dexterity required. I mean, and a lot of them don't.
No.
They look at how they dress, look at how they look. I mean, look at a lot of things. It's not for everybody. It's like everyone is capable of being an interior designer. I mean, you could go to design school and become an interior designer, but that doesn't mean you have the first thing about being an interior designer. Same thing applies to cosmetic medicine. You have to have a clue. You have to know it looks good, and you have to have the dexterity and the digital capability to perform the procedure on top of knowing, the sculpture, the dimensional aspect, the spatial relationships, the symmetry of everything that you do. So on some levels it's very simple, but on some patients it's actually somewhat technical and very involved. So.
What do you think these patients should be looking for when they're going to, I think a consultation is the perfect way to start, right? You're getting into a partnership.
Yeah, you got to feel comfortable with the
go
person.
into the practice, go into the person. You have to trust them. You have to think they're coming from an educated standpoint, because it's with your safety, right? I mean,
yeah, I think that's a great idea.
It should be like the norm.
A lot of times you can perform a consultation prior to the service, but at the very least, you can call it a consultation with possibility of doing a service same day, but because a lot of patients don't want to break it up into two separate appointments. But just book it as a consultation, and say, if I want to get it done, can I get it done the same day? Because it's important you feel comfortable. You don't want a patient that is not comfortable, that's suspicious, that is very unsure. You don't want them regretting anything they did. You want them to have the time to think about what they're committing to, and also feel comfortable with the provider, because there's nothing worse than having someone that's very anxious and very concerned after they leave your office.
We have I hear it all the time where all the patient coordinators know what pre-procedures, like pre-post instructions, pre and post instructions, procedures to go over, right? Depending on the type of treatment they're doing. And I'll listen to the call recordings just to make sure everything's said properly. And 5 times out of 10, these patients have gone elsewhere and they're like, wow, I never knew that. They never told me that. I didn't know there was any prereqs prior to going into a procedure like this.
No.
It's crazy.
I mean,
no pre-procedures, no pre-instructions.
Pre and post procedure
instructions at all. Like zero. And
I mean, some don't require much, but I mean,
yeah, but like anything laser based, right? Or like if you had previous history of cold sores and anything of that on antibiotics, anything light sensitive, and it's like brand new. They've been doing treatments for years and no one ever told them.
Let me ask you a question. Have you ever thought about introducing a new service to your office? Maybe how to grow a really nice mustache. Like, you have a fucking beautiful mustache.
It's so funny. I think I shaved yesterday for the podcast.
Mustaches are becoming more and more popular.
I left the mustache, the mullet, the mustache. I left it all.
A wonderful mustache.
I think it's in right now. Yeah. I've got no problem with it. But I like I like wellness right now. I think we could both agree that.
I think wellness is.
And big. You've got a full wellness suite. We're not there yet, but your wellness suite is significant. Dive into the difference between your red light therapy bed and what a lot of it seems big in chiropractic care. Red light therapy for weight loss, which we could both agree. Red light therapy is incredible benefits, not for weight loss though. But difference between yours and others, the hyperbaric you have.
There's a lot. Just like any device, whether it's a laser or a red light bed. There's obviously, from first glance, it can look very similar. But there's a lot of technical differences in terms of how much energy output it produces, the type of bulbs it has, the different wavelengths of light that it produces, etc.
Well, red light therapy for weight loss, does it work?
No.
Okay. And so what is it for?
Rejuvenation. It can help with the skin. It can help with your metabolic rate slightly. It can help with your overall energy levels. It can help with recovery in terms of blood flow and oxygenation of the tissues.
What about the hyperbaric for post-surgery?
Wonderful.
Right?
Absolutely wonderful.
Mm-hmm.
I think if you're dealing with any pre or post-surgical procedure, you can prepare for the procedure with hyperbaric oxygen treatments, and then after the procedure, receive maybe a week or 2 weeks of treatments to increase or decrease recovery time substantially, and also improve outcomes substantially in terms of less rates of infection, less rates of complications, and better healing scars, etc.
Yeah, what's the name of the device you have again?
It's an OxyHealth 40S420 chamber.
And it goes all 3 atmospheres or 2?
3 atmospheres.
3 atmospheres, yeah.
And it's FDA approved, which a lot of these hyperbaric...
What about the hyperbaric chambers that are like not fully enclosed? Have you seen them? You have these clinics that pop up and they're just hyperbarics only. And they're some of them are not even like metal, or like they're somewhat open.
They're like plexiglass.
Yeah, plexiglass.
Yeah, those usually only go to the 1.3 atmospheres, and they're not FDA approved. They're kind of comparable to portable hyperbaric chambers that you might have in your home or something. But there's a wide variety of applications to medical grade hyperbaric oxygen chambers, like the kind you would see in a hospital. And what was initially discovered, in the late 1800s with decompression sickness, the first application of hyperbaric oxygen chambers to prevent the bends, And now it's grown into something where if you have concentrated oxygen in the tissues due to the compression of the air, oxygen in your vessels, I mean, it has very, very good outcomes for autoimmune disease states, post-traumatic brain injury. Obviously, it's been used a long time for burns and wound healing. But now, even stroke, post-stroke treatments to reduce the amount of damage surrounding the site of stroke in the brain, for recovery from injuries. I mean, obviously it's used in professional sports a lot to increase or decrease the recovery time for a lot of these injuries or surgeries that these athletes undergo. So it has numerous applications, and now, I mean, one of the newer ones is cognitive benefits.
BTL came out with that cognitive device. Did you see that?
Yeah, ExoMind.
Yeah.
Yeah. I mean, that's not a new technology, but I mean, again, maybe they've refined it somewhat. They've reduced treatment time a little
It's
bit.
got a hefty price tag.
It's very hard to make your money back on that. But
It's
I mean, I think there's
significant.
something to the. I'm not saying, from depression or dysthymic issues that you may have. It's not an effective treatment, especially for refractory cases that aren't responding to typical treatment paradigms like SSRIs, SNRIs, cognitive behavioral treatments, or cognitive therapy. I mean, that has shown a lot of promise, but I mean, I don't know if it's worth spending $250,000 on that particular device. There are cheaper alternatives out there.
All right. Well, guys, thanks for tuning in. We'll see you next week.